Good morning. Summertime is in full swing. Hopefully you have plans to get outside and enjoy the day in between the bursts of rain that might be coming our way. The kids, no doubt, are going to be outside. So are your pets probably. Guess what else is outside this morning? Ticks, and you don't want those ticks coming inside. So it's a good time for us to check in with Dr. Chelsea Ryan. She, of course, is at CHI Memorial's Integrative Medicine Associates. Great to see you this morning.
Good morning, good to see you.
So I guess, this is something, who doesn't have a tick story, right? Whether it's one that you pulled off of your husband's neck or your dog's fur, we're all susceptible to running across them.
Yes, exactly. Yes, we've already pulled some ticks off my husband this year when he's out playing in the poison ivy. So definitely something that I see at home and here at work.
Okay, so I'm sure people are going to say, well, how do I prevent them latching onto me to begin with? Is the chief line of defense, Dr. Ryan, the clothing you wear when you're outside?
So that helps to prevent them attaching. I was doing some reading on the CDC last night, and there are some treatments to clothes that you can actually do. So for methrin, there's a treatment for that. There's some deep bug spray that is specifically for ticks. I did, interestingly enough, and I hadn't thought about this, and I'll share it with my patients, is that tumble drying your clothes on high for 10 minutes, that will help kill any free ticks that are on your clothes, and then washing them in hot water, because it seems like the cold water or cold dry, that does not kill the ticks completely. So yes, first line of defense is probably clothing.
Okay, so maybe then if your kids have been out, we'll go with the kids, or like you said, your husband's out doing cutting the grass or what have you.
Yeah.
Before you put the clothes in the wash, you're saying throw them in the dryer on high for about 10 minutes?
Sure, if it's something that you don't need to wash, I would throw them in the dryer if they're going to put them back on.
Oh, okay.
But if it's something they were dirty or messy, just go ahead and wash them on hot.
Okay, I'm sorry. I thought you meant dry them first, then put them in the wash. I'm a
No, that's
person.
a little too much for even me. So.
Okay, so when you find one, I guess the temptation is to go grab those tweezers and pluck it off because you want to get it off quickly. But you have to be careful, right? Because you don't want the head to get buried in.
Yeah, so you want to do the best you can. You take some very nice tweezers, go down to the base of the skin and try to pull up from where it's attached. If part of the mouthpiece or the head gets embedded, that can be okay. You just want to make sure you clean it really good with soap and water and just remove any parts that you can still see. I've had patients come in and we've just needed to use like a fine sterile needle to remove the rest of those parts. But yes, just do the best you can. I have had people talk to me about lighting the tick with a lighter or painting it with nail polish to have it come like back out. Don't do that. The biggest thing is to go ahead and remove that tick as soon as possible, because the longer it's attached, then the more likely it can spread pathogens and cause some problems.
Okay, so of course the concern we all have, and rightly so, is what if the tick that's attached onto you has Lyme disease? There are certain ticks that are more prone to carry that, right, than others?
Right, and so actually Lyme disease is not as widely spread down here in this region. Now, if you do get Lyme disease while you are here in Tennessee, it's more likely that it came from a tick that has traveled on an animal. But we do have other tick-borne illnesses that are prevalent here, such as ehrlichiosis, or the Lone Star tick can cause alpha-gal syndrome, which can unfortunately make you get pretty sick when you eat mammalian meat. So definitely want to remove those unless you don't want to eat bacon anymore.
So this is a crazy thing, I guess, to think about, but I've done this before with a spider where I caught one and I wasn't really sure how to identify it. If you remove a tick, is it a good idea maybe to keep it for a couple of days in case some symptoms show up?
That's exactly it, yes. And I have had a couple people bring them in. And so if you start, and also, you're watching for those symptoms that are dangerous for those tick-borne illnesses. A lot of them are similar. You're looking for fevers, achy joints, the bullseye rash, any rash really. You want to contact your primary care provider to at least get it looked at, talk about if antibiotic prophylaxis is needed. But yes, holding on to that tick for a couple days is fine. Just put it somewhere that maybe a kiddo won't snatch it up or won't end up in your food.
And then you mentioned a tick traveling in by a pet. So even if you're just here in your own backyard in Chattanooga or North Georgia, when your dogs and cats go outside, they can bring them back in. But will the ticks, kind of like fleas, first choose to go to the pet, and then if they can't get on the pet, they'll come to you?
Right. So I unfortunately have a couple dogs that like to sneak into bed when I'm not there, and I've had a couple ticks travel in on their long fur. Now they're treated for tick and heartworm and things like that, so the tick is supposed to fall off if they bite the animal, but especially if you have long-haired pets, it's really easy for those ticks just to kind of catch on to that hair and come in either in are on beds or clothing, carpet, or really anywhere in the house.
Okay, I think I have two questions left. The first one is with the monitoring of your symptoms, like you mentioned, is early intervention key, Chelsea?
Yes.
Okay.
That's exactly it. So under 36 hours and the engorgement of the tick is really important. If you have any questions though, don't hesitate to call your primary care provider. We can do virtual visits pretty easily. We can have you come in, and sometimes there's just a localized reaction like just very itchy red spot there that we can give you a topical steroid for.
And then the DEET spray that you were talking about, is that safe for everybody in the family? I mean, can kids use that too?
Right, and so I would definitely consult either your pediatrician or primary care provider before using those DEET sprays. There's certain oils in some of the bug sprays that you have to be careful about for using for the pediatric population.
All right, well, what a great topic, because this is a universal issue that we deal with for the next several months around here. Good to see you this morning.
Nice to see you.
You too. If you're looking for a primary care doctor of your own, she is taking new patients. It's Dr. Chelsea Ryan. She's with Integrative Medicine Associates, part of CHI Memorial up on Signal Mountain. Her phone number 886-2004. Online, chimemorialmedicalgroup.org. We're back after this.
Hi everybody, time for another West Shore home bath transformation. I'm on site today with Kirsten and the crew from West Shore. Hey Kirsten.